This is the moment no leader ever wants to face. It's when the operational realities of running a hospital collide with the human reality of the people who make it run. Workforce reductions. Layoffs. Whatever you call it, the weight is the same. As a hospital leader, you're facing the most gut-wrenching task in leadership. This isn't just about numbers on a spreadsheet or tweaking a budget. It's about the lives and livelihoods of your dedicated staff, the nurses, technicians, administrative teams, and support staff who have poured their hearts into your mission. These are people with families, mortgages, and futures that are now completely uncertain. How you lead through this moment will be the ultimate test of your character and integrity. It will be remembered by your community, your remaining staff, and by those who leave, long after the financial pressures have eased. This crisis will define your legacy more than any period of growth or success ever could. There's no easy way to do this, but there is a right way. And it means moving beyond the standard corporate playbook and leading with genuine humanity. Many leaders in this position make a critical, yet understandable mistake. Faced with overwhelming pressure and the deep personal discomfort of the job, they go silent. They retreat behind closed doors, hoping to manage the process quietly, praying it will all just blow over. But that silence is a betrayal. It creates a vacuum of information that fear, rumor, and anxiety will always rush to fill. That void doesn't just cause panic, it systematically tears down your most valuable asset, trust. It tells your people, both those leaving and those staying, that they aren't valued enough to be given the truth. It poisons the culture and leaves a scar on the soul of the organization that can take years, if not decades, to heal. In this video, I'm not going to give you platitudes or corporate jargon. I'm going to give you a clear 3-step framework to lead with integrity, manage this crisis with the humanity your people deserve, and keep the trust of those who are leaving and, just as importantly, those who are staying. This is your guide to navigating the storm, not just as an executive, but as a true leader. Section 1. The anatomy of a leadership failure, the problem with silence. Before we get into the framework, we need to understand why so many well-intentioned leaders fall into the trap of silence and secrecy. It's not because they're bad people. It's because they're human. The pressure is immense. You're caught between a board demanding financial stability, a community that depends on you, and a workforce you genuinely care about. The emotional toll is staggering. You feel lost, anxious, and maybe even guilty. The instinct to delay, to put off those painful conversations, is a powerful form of self-preservation. But the consequences of that silence are catastrophic. When leaders go quiet, employees don't assume the best. They assume the absolute worst. Every closed-door meeting becomes a secret group deciding their fate. Every hushed conversation in the hallway is read as a sign of impending doom. Productivity plummets as people spend their days updating resumes and speculating with colleagues, paralyzed by layoff anxiety. Your top performers, the very people you need to rebuild, start looking for the exit, worried about the stability and culture of the organization. They see the lack of communication not as a strategic delay, but as a profound sign of disrespect. This silence doesn't just crush morale, it directly impacts patient care. A distracted, fearful, and demoralized workforce cannot deliver the high-quality, compassionate care your patients deserve. After poorly handled layoffs, the morale of the people who are left is often destroyed, leaving a sullen, dispirited team to carry on. They feel a sense of survivor's guilt, mixed with anger and anxiety about their own futures and bigger workloads. And let's be honest, the American healthcare system is already facing an unprecedented crisis. In 2025 alone, dozens of hospitals and health systems have announced workforce reductions, impacting tens of thousands of employees amid immense financial and operational pressures. Even federal health agencies have seen massive job cuts, reducing staff by the thousands at the FDA, CDC, and NIH. In this environment, your actions are under a microscope. How you manage this transition sends a powerful message to your entire community about what your hospital truly values. Are they just words in a mission statement, or are they principles you live by, especially when it's hard? The American College of Healthcare Executives stresses that any decision to reduce staff demands deep consideration of the impacts on all employees, both those leaving and those staying. There is a huge ethical conflict between stating organizational values and then acting without compassion during a staff reduction. So what do the best leaders do instead? They understand that while they may not control the financial realities, they have absolute control over how they lead their people through them. They reject the vacuum of silence and choose radical transparency. They lead with humanity. They follow a clear, intentional framework. Section 2, the 3-step leadership response framework. This is not a checklist you delegate to HR. This is a leadership mandate that you have to own from start to finish. It's built on 3 core pillars: communicate with clarity and humanity, care for your departing team with dignity, and lead your remaining team through the aftermath. Step 1, communicate with clarity and humanity. The antidote to fear isn't false optimism, it's truth. Your first responsibility is to communicate with a level of transparency that might feel uncomfortable, but is absolutely essential. This communication has to be early, it has to be honest, and it has to be human. First, you have to share the why. This is non-negotiable. Your employees are not children. They are dedicated professionals who deserve to understand the context behind this painful decision. You need to hold meetings and clearly explain the business reasons. Is it due to declining reimbursements from payers, a major factor cited by 84% of health systems with low margins? Is it because of soaring labor costs or a fundamental shift in patient care? Hospital officials need to be able to explain why each layoff is necessary. This isn't about making excuses, it's about providing the clear, honest business rationale that shows this was a decision of last resort. Your senior leadership, starting with the CEO, must own this message. Admitting what went wrong or what challenges the organization faces is how trust is built, not broken. Second, you have to be explicit about the what and the how. When there are no facts, rumors take over. You must control the narrative with clear, consistent information. This means communicating the timeline, the scope of the reductions, and which departments or roles will be impacted. Critically, you must explain the objective criteria used to make these decisions. This transparency shows fairness and can help lower legal risks and the feeling that decisions were random. You need to review your hospital's vision, mission, and value statements to make sure your actions line up with your principles. This is the moment that tests whether what your organization says it is what it actually does. Third, you have to deliver the message with humanity. This is not the time for a sterile, pre-written corporate memo sent from an anonymous HR email. This is a time for face-to-face communication, even if it's over a video call. When you speak, you must do so with empathy. Acknowledge the pain. Say the words, "This is difficult. We value the contributions you have made. And I am truly sorry we are in this position." Research shows that when the layoff process feels fair and transparent, it can actually reduce the negative health impacts on employees. Your genuine compassion can make a world of difference. You must lead with empathy, recognizing the emotional toll these decisions take. Your communication plan has to be comprehensive. It should be a cascade of information, starting with senior leadership and managers before any public announcement, so everyone delivering the news is aligned. Then, after individual conversations with affected employees, hold an all-staff meeting as soon as possible to address the entire organization, answer questions, and stop the rumor mill before it starts. It's your duty to plan, manage uncertainty, and guide your people through the storm. Step 2, take care of your departing team members with dignity and respect. How you treat people on their way out the door is a direct reflection of your leadership and your organization's character. Your remaining employees are watching. Your community is watching. This isn't just an HR function, it's a moral obligation. The notification conversation is one of the most difficult and most important moments in this entire process. This talk must be handled with the utmost compassion and respect. It should be done in private, in person whenever possible, with someone from HR present for the technical details, but with the direct manager leading the conversation. Using a rigid script is a mistake. It feels inhuman. While you should have your talking points, the priority is to be present, direct, and compassionate. State the news clearly at the start of the meeting. Don't make small talk. Then, and this is critical, stop talking and listen. Give the employee time to react, to vent, to ask questions. Your role in that moment is to absorb their emotion with grace and empathy, not to defend the decision. Your support must go far beyond the legal requirements of a severance package. While severance pay is important, true compassionate offboarding involves a whole suite of resources to help your people land on their feet. This includes providing outplacement services, which can offer career coaching, resume help, and job search support. Studies show that employees who get outplacement assistance are 38% less likely to hold negative views of their former employer. Also consider extending health benefits. For instance, if layoffs happen late in the month, think about making the official termination date the first of the next month to give employees a full 30 days of health coverage to make new arrangements. But you can and should go further. As a leader, you can personally offer to write letters of recommendation. You can make introductions to contacts in your network. You can make sure they know their contributions were valued. Honoring the work of those who have left isn't just a kind gesture. It helps those who remain process their own feelings and see that the organization has a soul. Taking the time and effort to treat people with care and dignity will protect your employer brand and might even allow you to maintain a positive relationship with former employees who could one day return as boomerang employees, clients, or patients. Your ethical obligation is to minimize harm and support people through retraining and redeployment if possible. This is your final act of leadership for them, and it's the one they'll remember most. Step 3. Lead the remaining team through the aftermath. The day after the layoffs is, in many ways, day one for your new organization. And your leadership is more critical now than ever. It's a huge mistake to assume that the survivors are just grateful to have a job. The reality is far more complex. Your remaining team is grappling with a potent mix of emotions: guilt for surviving when their friends didn't, anger at the organization, anxiety that they might be next, and overwhelming stress about their new, heavier workloads. Overlooking the mental health impact of layoffs on those who stay hurts both the individuals and the organization. Your first job is to acknowledge and validate these feelings. Don't pretend it's business as usual. Hold team meetings specifically to talk about the changes. Create a safe space for people to express their grief and fears without judgment. Saying it's not personal is probably the worst thing you can do. Of course it feels personal. Your vulnerability is an asset here. Admitting that you too are saddened by the loss of colleagues shows you're a human being, not just an executive. This builds connection and allows the healing to begin. Address survivor's guilt head-on by openly discussing the support being provided to departing employees. It reassures those who remain that their colleagues were treated with dignity. Next, you need to immediately clarify the path forward. Uncertainty is the enemy of productivity and morale. Your team needs to understand the new structure, their revised roles, and who is now responsible for the work of their departed colleagues. But you can't just expect the same amount of work from fewer people. That's a direct path to mass burnout and failure. This is a critical chance to reevaluate all work processes. You must lead an effort to identify and get rid of low-priority tasks, streamline processes, and focus only on what's most essential for patient care. This shows you respect your team's time and well-being. To rebuild momentum, you need to reconnect the team to the mission. Remind them why they chose a career in healthcare. Shift the focus from the pain of the past to the purpose of the future. Celebrate small wins. Recognize and appreciate your team's efforts as they navigate this tough transition. This is the time to overinvest in your people. Offer new training and development opportunities to help them get the skills they need for their new responsibilities. This not only improves their capabilities, but also sends a powerful signal that you are investing in their future with the organization. And finally, you have to be visible and present. This isn't the time to hide in your office. Don't just manage, lead. Walk the floors. Be available. Have more frequent one-on-ones. Ask your team what they need to be successful and genuinely listen to their answers. You need to be a source of stability and confidence, even if you have to find your own support behind closed doors with mentors or peers. Your team needs to see you're in the trenches with them, committed to navigating this new reality together. Actively watch for burnout and adjust workloads as needed. Your visible, consistent, An empathetic presence is the glue that will hold your team together and allow you to rebuild trust, morale, and momentum. Conclusion and AMP, CTA. Navigating a workforce reduction is a crucible. It will test every aspect of your leadership, your empathy, and your resolve. The financial pressures that lead to these decisions are often immense and unavoidable. But the way you lead through them is a choice. It's a series of choices that will define your reputation and your legacy long after the crisis has passed. Remember the framework we've discussed. It's your compass in the storm. First, communicate with clarity and humanity. Reject silence and embrace radical transparency. Explain the why with honesty and the what with precision, always delivering the message with genuine empathy. Second, take care of your departing team with dignity and respect. Honor their contributions by providing compassionate offboarding and real support that goes far beyond a severance check. How you treat people on their worst day is the truest measure of your organization's values. And third, lead your remaining team through the aftermath. Acknowledge their survivor's guilt. Clarify their new roles, protect them from burnout, and visibly lead them forward by reconnecting them to your shared mission. This isn't easy. It requires immense courage, emotional resilience, and a deep commitment to doing the right thing, especially when it's hard. But leading with integrity through a crisis isn't just about damage control. It's an opportunity to forge a stronger, more resilient organization built on a foundation of real trust. It's how you show your people, your community, and yourself what true leadership really means. This is the moment where your legacy will be written. To help you put all this into action right away, I've created a detailed crisis communication checklist for healthcare leaders. It breaks down the key steps for communicating before, during, and after a layoff, with templates and talking points you can adapt for your organization. It's a practical tool to help you lead with the clarity and humanity this moment demands. You can download it for free using the link in the description below. Lead with courage. Lead with compassion. Lead with integrity. Your people deserve nothing less. I'm so glad you joined me here on Meta Leadership Development. If this word encouraged you, please like, share, and subscribe. It helps spread light and truth. Remember, your influence is a gift, your growth is a calling, and your strength comes from Christ. Stay rooted, stay faithful, and keep leading with grace.